problems. The third point, thank you, that's a little dramatic. Third point is that in the state of Virginia, unlike 39 other states, insurance carriers don't have to cover PKU treatment like they do other medically necessary treatments. How could this be? PKU is deemed significant enough to be included in newborn screening, but not significant enough where insurance providers have to provide the proper treatment for maintenance. You're going to hear from the insurance companies that they cannot cover this, that they simply cannot afford another exception to their policies and need to safeguard costs. I agree. I'm not here to argue the importance of regulating healthcare coverage. I am here to tell you that they can provide coverage for inborn errors in metabolism with minimal cost impacts to their existing policies. In fact, in some cases, insurance companies already are. Two of the major insurance covers in Virginia provide coverage for me as an exception. It's a good thing I like my job. They don't cover it as a matter of course, except in 39 states where it is mandated. The numbers don't lie. PKU impacts an estimated of 15,000 people in the United States. That's about 300 in the state of Virginia total, which is really just about 10 patients per year going forward. The numbers requiring medical food and formula are small, but the impacts are huge. Without formula, our kids cannot live a normal life. Formula costs are estimated between $7,000 and $10,000 a year, and for a family like mine, that's a lot of money. 39 of the 50 states have solved this problem for their citizens by requiring insurance coverage. And they treat the formula just as what it is, a medicine that is absolutely necessary for the health of the people who need it. They understand that if left untreated, the estimated cost can range from $60,000 annually to as high as $200,000 a year for inpatient mental health facility. Any parent of a PKUer is going to do what is needed to ensure their child gets the treatment they need. But if it's not covered in most of our, but if it is covered in most of our neighboring states, many of us face the possibility of having to move out of state just so that we can get the treatment that they need. This formula provides almost all the protein my daughter needs to live because she can only tolerate less protein than you will find in one glass of milk. Without this formula, she does not get the daily requirement needed for protein to live. It tastes terrible, it smells terrible. As Laura mentioned, this isn't something people are going to be running to the store to purchase. It's not a glorified health shake that you're going to find in GNC. There doesn't need to be concern that this formula is going to be used for anything other than to treat the specific medical conditions that are listed in the bill. I believe that this is one of those rare times when an insurance exception is required and that legislation can improve the lives of citizens, retain its competitive position with other states, and save money for the same action. I respectfully request you to support House Bill 601.
And thank you for coming out.
Sorry for leaving.
All right.
Hi, my name is Shanna Monaco, and I'm here with my daughter Caroline, who is 13, and my son Stephen, who is just 18. They have a disorder similar to PKU, but it's called isovaleric acidemia, known as IVA. And if any of you were here in 2004, 2005, you may have been part of a vote to expand newborn screening to include their disorder. I was here back then with these two children, although Caroline was a little toddler then, kind of running around. Because Stephen was born with isovaleric acidemia, as explained, it's a genetic condition, but there